Namaste. Welcome to our YouTube channel and myself Dr. Kirtan Doshi from Samvedna Homeopathy Clinic Ahmedabad. So I am back with a new topic called the drug picture of X-ray from the book S.P.Dey. So today's topic will be helpful for the doctor. So X-ray indications and what is the disease this X-ray can be in which disease this X-ray can be useful. We all know that X-ray has been proven by Bernhard Fink in 1897, and this S.P.Dey book, it is very teeny book, only a 19 or 20 page book, but it is the gem. When I read, I understood that in which cases this X-ray can be indicated. So right now in today's era we are facing the complex cases, the mass cases, the all mixed miasmatic conditions cases, and also disease which is very grave or deep pathological cases. So in this condition this X-ray can be useful. So in clinical conditions like obstinate eczema, pigmentary diseases, psoriasis, vitiligo, alopecia cases, it is very useful. In the cases of obstinate rheumatism, gout, this X-ray is also indicated. Also when there is a pre-malignant conditions or warts, ganglion, cone, it is useful. It is also useful for the sterility when there is a oligospermia or azoospermia. It is useful when there is a amenorrhea, either primary or secondary, in the ulcer and the wound which is refused to heal. So we all know that X-ray, repeated exposures to X-ray causes the burn and the injuries to the skin. So on the dynamic plane, it heals this wound and ulcers. In the sinuses and the fistula cases, the necrosis and the caries, so destructive pathology. And also the diabetes with reversible degenerative changes. It affects the CNS system and paralysis cases. Also retarded growth, the stunted growth like Barita Cab. Also the severe anemia or the varicose vein like arsenic or sickle core, the gangrene case, or when there is a lack of reaction to well indicated drugs, this X-ray is the indicated. So what is the characteristic indication when we can think? So this is the long list, but I will only narrate the important point. When there is a long lasting suppression of the miasmatic affection, this X-ray is very indicated. So long lasting suppressions, the X-ray is powerful, which can bring the old suppressed symptoms back. So vitality should be checked and it should be in a good condition, so that vital force can eliminate or can cope up with these symptoms. So the fatal consequences can be avoided when we give the X-ray. Also when there is a mixed miasmatic conditions, or when there is a two miasm like psychosyphilic or sorosyphilitic cases, in the paucity of symptoms, we all know when the diseases are grave, diseases are deeper, the less individual symptoms, only the common or the nosological symptoms are there. So at that point X-ray can be thought, and when X-ray is given, the vital force is aroused or react, and this bring the symptoms to the surface of old suppress. Also some accessory symptoms are coming, so we can give more deeper indicated remedy. Also in the primary or secondary degenerative cases, the more the suppression, the more the X-ray is indicated. As per the example, when cancer of the cervix has been detected followed by repeated suppression of the chronic leukorrhea, or any suppression of the psoriasis or scabiasis result into something grave pathology. So more the longer suppression, more the X-ray is indicated. When well selected remedy fail or ameliorated for a shorter time, this X-ray can be thought. So it is more powerful than the carbovase, zincum, sulfur or opium. We all know the cure should be taken place according to the Herring guidelines, means Herring guiding. So the more symptoms should be diverted from the center to periphery, from more vital organ to less vital organ. So when symptoms go in the wrong direction, means not following the Herring law of cure, this X-ray can be indicated and antidote at sometimes when needed. So when there is a organic symptoms, as per example, organic symptoms increases with disappearance of the surface symptoms. So these symptoms go in the wrong direction. So this X-ray can be indicated. Also we all know the cases when there is a allergic to detergent, the rough, scaly, bleeding or fissures in the hand. when we are giving so many medicines, it is been acting like Dalkamara, Natramur, Thuja, Graphitis, Petroleum, etc. But it is for the short time, and not the cure is been taking place 100%. This X-ray can also think of in this kind of the scaling and the bleeding palm. So for the palmoplantar psoriasis can be also X-ray can be indicated. So what is the indications? Complete anorexia, but with desire for sweet, as it is more destructive pathology. All symptoms aggravated at the night, like syphilinum. So all symptoms aggravated at night is also the characteristic of the X-ray. Aversion to meat, or prostration or the lassitude of the mind and body without any remarkable suffering. Mental confusion. Patient is very irritable and but desire to be alone. Polyuria at the night. Also, left kidney pain. So when you think the Berberis vulgaris, so left kidney renal calculi pain, also the X-ray is indicated. And doses is very important. According to this book S.P.Dey, it is only as I said earlier, hardly 17 or 19 pages. But as per his experience, he always give or try to begin the case with 200 single dose. And as per this book, at longer interval, sometime we need to repeat. But whenever we find that repetition is needed at longer interval of single dose, rather than jumping from 200 to 1 m, he say that you should stroke a file and give to the patient 200 again the doses. And also in this book, what to do when the old symptoms reappear, or when we have to leave this X-ray alone. So this is a long list, but I am reading the first possibility. As long as the patient is improving with this X-ray, we can safely wait and watch. Second possibility, if the old symptoms reappear and the passes of themselves so also we can wait. Third possibility, if the old symptoms reappear and persist unchanged for a longer time, then we can repeat this X-ray either in the altered, means you can give succussion to the file, or in a higher potency from 200 to 1 m. Fourth possibility, if the old symptoms still persist and clearly indicated some new constitutional medicines, then you can definitely give this, but not less potency what have given previously. Means you have given X-ray 200, old symptoms reappear and it remain unchanged for a longer time, and some new medicine indicated. So you can start this new medicine like phosphorus is indicated, or carcinosis is indicated, or anything. So you can give 200. If the old symptoms become troublesome, but the present condition has been improving, and this suggests new medicines, so you can give in a lower potency, means 6CH, 12C or 30, or in the LM potency. We are only to leave this X-ray, fifth possibility, when we are sure the drug has done whatever it is capable of doing in such cases. And after the X-ray has been given, what is the criteria, or when we can judge, or how we can judge that it has been giving a relief to patient. If the old symptoms is appear, it is very good sign first. If any discharge has been increased for a shorter time, or any functional changes are occurring, it is very good sign. Like leukorrhea is increasing, or loose motion occurring, or minor hemorrhage, or fluent coryza, this is a very good sign. Also, if the patient as a whole feel better with aggravation of the present symptoms, if the functional symptom aggravate with amelioration of the objective finding or organic changes, or in general the patient appetite, sleep, mental state, or general appearance being improved simultaneously with the feeling of general well-being, these all are indicated that X-ray is been acting and it is on the right path. And also in this book he illustrated some cases from his clinical practice also. So anyone want to read or interested in this book, kindly comment your mail address. I will send it to you also. And yes, like, share and subscribe to our YouTube channel for more such information in the future also. Bye bye, take care, thank you so much.